AMR yembeera nti oyina kye tuyita infection oba akawuka oli n'oweebwa eddagala ly'akawuka ako naye ng'akawuka tekakyawulira ddagala, n'olwekyo eddagala eryo liba terikoze. Kivaamu ebintu eby'enjawulo, kivaamu omuntu okufa obulwadde obwo bw'akawuka ako lwakuba eddagala terikola, oba ne kivaamu okusigala mu ddwaliro ekiseera ekiwanvu ku kye twandisuubidde. Omuntu eyandimaze ennaku 3 mu ddwaliro n'amala wiiki emu oba 2, kivaamu okwonona ssente.
Olaba nga oba otambudde mu street za Kampala olaba buli muntu alina kanula, omubuuza nti no kanula ni agikuwadde, nze nafunye omusujja nengendayo bakupimye nedda bagambye oba ndina
Abamu ku bannaffe abali mu malwaliro tebagoberera guidelines eziri mu minisitule zeewadde. Ekyo kintu kikulu nnyo. Ojja kugenda bakuwe kasamari olabe ekigenda mu maaso. Kiba kitegeeza tulina okuddamu okutendeka abasawo abamu. Ekyokubiri, abamu ku bannaffe bagenda okwejjanjabisa, awulira bubi n'atambula butambuzi ogenda ku kafamasi ne bamuwa ampisi, naye nga ampisi ono tajja kukola kubanga alina akawuka akatawulira ddagala. Ekirala, abalimisa n'abalunzi bakozesa nnyo antibiotics, ate naffe ne zitukosa. Twawulirako nti waliwo abawa antibiotics enkoko, embizi. Twategerako nti n'eddagala lya mukenenya ya ARV waliwo abalimisa abalunzi b'embizi abawa ARVs. Kale nno ekyo kirala kyekitwala ekizibu kino mu maaso ekya antimicrobial resistance. Ku musomo ogwakolebwa mu nsi yonna gwe twetabamu nga Uganda, twafiirwa abantu akakadde kamu mu emitwalo 2. Abantu abo basinga bava mu nsi ze tuyita least developed countries, of which Uganda is one. Mumanye nti tufiirwa obukadde 25 buli mwaka olw'ekizibu kino ekya antimicrobial resistance oba AMR. Ezo ssente ku ggwanga eryaffe nga bwe liyimiridde ssente nnyingi ddala.
We have to put amateeka to show that buli mukozi, health worker, alina kumanya before otuuka ku ddagala lino, have you gone through these checklists? Totandika with IV ceftriaxone, because IV ceftriaxone obanga olina ka pharmacy or drug shop yekuwa magoba, it is expensive, you understand. Tandika ne penicillin, amoxil, tulina amadala agadagala. Oba okolola, you don't start with ceftriaxone. You start with the lower antibiotics as you go up. But what we are seeing, when you go out to most of these drug shops, for them, they want to sell. So we are now telling National Drug Authority, Tugama National Drug Authority, National Medical Stores, mulina enforcement arm about inspectors, mugende nga mukebera drug shops zino. And then Fenga Parliament, tulina kuleta that eteka the National Drug Authority Act, nkadde nnyo 2023. Tujirete, we do an amendment and we make it speak to the challenges is bulijo. And then to take ne penalties. Because if we find with a drug shop or pharmacy, you don't have a license, tukubuza until how are you giving out these drugs? Because obuzibu, you get my point. Naffe senior doctors abaluddemu osanga oli ye for the last 20 years he believes in oba penicillins oba ceftriaxone. Kati we have to tugamba ministry with the national treatment guidelines so that omukozi alimu amul ekoboko ekabong ebera standard. We know that when omulwadde aja, this is the first line of treatment, this is the second line of treatment. Naye katula obulwadde bwa TB waliyo abalwadde abangi have developed resistance. And we have only first line, second line, and third line. So we are getting multi-drug resistance.
Definitely, antimicrobial resistance remains a major cause of morbidity and mortality. The unfortunate part of it, why sometimes we are not putting a lot of effort, is that we are not able to quantify how big the burden is. Because we are there, and when we look at what's the major causes of our mortality, I don't think in my HMIS I can be able to see that it's antimicrobial what? Resistance. So, and yet it's the many of the people definitely is related to that aspect. So we are looking forward that partially the study in the health facilities will be able to guide us as policy to be able to make it so that we can be able to do that. I've spoken to aspect that I've done analysis, and I've looked at that sometimes facilities definitely askew themselves to aspect of antimicrobial use from the infection point of view than the aspect of prevention. So we need to be able to look at that aspect, and we are looking forward to using this information and seeing that how can it be able to influence our decisions? How can it be able to influence? So I expected the Department of Pharmacy to be among the people who should have been really here, and definitely, and the other big providers like NMS and GMS, because this information is key. So the context which we want to do that we want that all our decisions are data-driven, and we cannot have them data-driven if we do not have the information. So I really want to thank again IDI for working on this. But I imagine that with the new geopolitics, definitely now we need that. How can we optimize this and see?
Thank you for honoring your invitation, and we invite you to the podium to give your remarks. Thank you.
Friends, and he sent me some remarks to send on. I will read them as they are. So, good morning, honorable guest of honor, esteemed representatives from the Ministry of Health, our valued juncture in Uganda's fight against AMR. Let us begin by commending the Camonet Uganda Hub for convening this important workshop, a testament to the power of collaboration in address silent pandemic. And to our guests, thank you for your presence. Your expertise and commitment are the fuel that will drive today's discussion, from ideas to, and we know it's a problem in patients battling with HIV, TB, post-surgical infections, and even cancer patients. And globally, AMR, 24 million people into poverty by 2030. And what are we doing at the College of Health Sciences?
Who is a convergence of many constituencies, if I can put it like that. He's trained as a medical doctor, but as many of you know, he is also an elected member of parliament for Koboko municipality. I think for me it's a great honor to introduce. He gave you as action. Honorable Ayume, before you came, when I was introducing remarks, I asked the audience to keep one word in mind for AMR, action. We've been talking too much, now action. But in thinking about Dr. Ayume, the word consistency. Dr. Ayume has worked with us in terms of academia engaging with the lawmaking process and making sure that our work is visible within that constituency. He has formally...
Honorable Dr. Ayume and the entire team here, we really appreciate the efforts you are putting in as yourself, but also for AMR at the level of detail and course of action you're taking. So for that, thank you so much. As we go into our next CDO, UK Foreign and Commonwealth Development Office, British High Commission. Please stand up for recognition. Thank you for coming. We are very grateful for all your support from the UK. Dr. Harriet Akello from the Ministry of Health, thank you so much for being present. Honorable Stephen Allo, Senior Economic Advisor. Dr. Rodney Tabaruka, Principal Pharmacist, Ministry of Health. I think the DG mentioned that we need the pharmacist, so having the principal here is very integral. Thank you so much for coming. And honorable and colleagues, I humbly request that we give these sessions utmost attention, because Brian, Vivian, Conrad, and Ellie, please come forward. These are our Camonet team members. Let us really appreciate them. They are the spiders in the web, ensuring that we get some data-driven evidence. Let us move fast. You are young, able men and women. So and as they present, please take note of
a pharmacist and a public health specialist working with the IDI, supporting the Camonet project as well as the Fleming Fund. Today, point of action, as Dr. Kambuga has already alluded to. The overuse of antibiotics leads to selective pressure, such
of what makes this work effective, and it's the heart of what for what you're doing today, but for what you've already achieved, and for how you continue to lead us.
But he has broken how much each patient who has AMR costs us as a country, how much it costs the hospitals, things like that. Okay. But you can ask him. Thank you. Let me get
screen of the Google Meet web page.
This is capacity strengthening and training, not Uganda, but across all the countries globally. So this is rooted in the work that's being done and led in Uganda, and we are deeply grateful for this. Your leadership, working with you. And so I wish you well. I hope you have a really productive day, make lots of connections, and I really look forward to, back to you, Andrew.
Thank you very much, Professor Allison.
Dr. Kambugu, and thank you so much, Prof. Allison. We both appreciate your leadership on the Camonet Global Program. And with that, we'll move into the next segment, which is going to include two speakers, one from academia, and then the other is Professor David Patrick Katete, who is, let us give him a round of applause, College of Health Sciences, Makerere University, and is here both in his capacity as the Dean, but also representing the principal of the